Hello, I'm Dr. Ruthie, sexuality educator and relationship expert. I blog over at exploringintimacy.com, and thanks to funwares.com, I'm here answering your sex and relationship questions. And I have a wonderful one that was just sent in by Kay. So let's see what Kay has to ask. Um, Hi, Dr. Ruthie. My question is about rimming. I love being both on the giving and receiving end of rimming. I've always heard that you need to use a barrier to prevent the transmission of germs. Is there any way to rim without a barrier? What if we're monogamous and tested? Thanks. I am so glad that you wrote that, Kay. That is a fantastic question. So first, let's figure out what is rimming. Rimming is also called oral anal sex and is sometimes also called analingus. And so you might guess from the names that rimming is all about pleasing your partner's anus or having your anus pleased with tongue and lips. So kissing, licking, tonguing, smooching, slobbering, whatever it is, getting right in there with the anus. That is rimming or oral anal sex or analingus. And so, as Kay mentioned, the suggestion is out there that folks use barriers for this activity. How come? Well, let's discuss. And this is a really great topic, especially because people of all gender combinations love this particular activity. Not that everybody does it or that everybody enjoys it, but it's certainly out there in every single sexual identity category that you can imagine. The anus, or your butthole, has a lot of nerves in it that are made specifically for pleasure. And this is not related to your gender or your sexual orientation. So all of us have these nerves there, regardless of our gender and regardless of who we're attracted to. And these nerves pretty much exist for sexual pleasure. So they're there, and so it makes sense then that oral sex in that particular area of the body could be very pleasurable if everybody involved is into it and is feeling turned on. However, just like all other sex acts, it carries a certain amount of risk with it. What makes it a little different from some other types of sex acts is that because it's in the anal area, it carries some risks in addition to sexually transmitted infections, STIs. We used to call them STDs, now we call them STIs. And of course, any kind of skin-borne sexually transmitted infection can happen. So warts and blisters and all those sorts of things from sexually transmitted infections can also be transmitted through oral anal sex. You can also have viruses transmitted that way and parasites transmitted that way. But the biggest risk, in addition to sexually transmitted infections, is bacteria. So that particular area of the body is at the end of the digestive tract, and we have all these lovely bacteria that are very essential to have in our digestive tract. We drink special yogurt drinks and all sorts of things for those kinds of good bacteria and whatnots. But they belong in the digestive tract and occasionally are excreted out, or I should say consistently are excreted out, but they don't belong in the mouth. Or any other areas around the face. So if we ingest some of this bacteria, what we might be most likely to encounter are things like fever, a case of the runs, cramping, really uncomfortable symptoms like that. And so this is what the barriers are for in addition to the sexually transmitted infections. So, okay, unfortunately, even if both of you are tested clean and you're fluid bonded to each other, which means that you're only sharing bodily fluids with each other and unprotected sexual activities with each other, you still really need to use a barrier for this. What about washing? Well, washing is kind of like tidying but not cleaning, and there's a difference between the two. So you might want to wash anyway if you want to, but it's not going to get rid of the bacteria or the viruses or the STIs if there are any. Also, if there's any minor breaks in the skin or hemorrhoids or anything like that, it's not going to take care of any possible blood transmission there as well. So go ahead and wash if you want. I'm never really a big fan of enemas. They disrupt the natural functioning of things inside, and they tend to be intended for folks who are constipated. So we know what they're intended to make happen, and for most folks, that's not what they want to happen right before or during any kind of anal play. Although, hey, if you're into that, no judgment from me here, then maybe that's for you. So enemas don't clean anything; they just make us feel cleaner. So that also will not do the trick. let's talk about your different options for barriers so that you two can work together to find the one or ones that work best for you. So the three most popular ones are a condom that well, I should say four. Let's go with four. A condom that's had the tip cut off and the ring cut off and sliced up the inside so it becomes a flat sheet. However, those are not very large, so I like to encourage people to kind of come up with other options as well. A sheet of plastic wrap will do just fine, whether you make somebody a little plastic wrap undergarment and go to town, or whether you just take a sheet up and you hold it while you enjoy your partner or your partner enjoys you. Just make sure whatever barrier you're using is not flipped over, right? Because then there's no point in having it there because you just, flipped it right around. Um, Dental dams are also lovely. They come in different sizes and they make a great barrier as well. But one of the most fun ones that you can use is to take a glove, and I suggest the nitrile ones because they don't have that nasty kind of latex flavor to them, but you pick what you like the best. Unpowdered is my suggestion. And what you do with the glove is you cut off all the fingers, but don't cut this area right here. So you're just cutting off the fingers and you're slicing up the side here. So what happens is you open it up and it's a flat space with a thumb on it. And where does the thumb go? The thumb goes right in the rear end, the thumb part of the glove. And so that means that you can be enjoying going to town on your partner, and you can also insert your tongue inside if you want to as well and not worry about the bacteria, or insert a finger or whatever you like. Now, whatever side is against the partner should be nice and lubey, regardless of whether you're using plastic wrap or dental dam or a cut open condom or a cut open glove. Nice and lubey. And then on your side, you can, the giver's side, I should say, you can put it on whatever you would like. If you want to put a little bit of honey on there, a little bit of jam, if you just want to leave it natural, whatever works for you, you can really dress it up and have a lot of fun that way with no mess because you just throw away the item when you're done. And again, remember, don't flip that item around. Once it's there, it's there. You can always get another one if you need another one. So take a little time to explore and enjoy. This is a wonderful topic to be exploring together, but it is something that you definitely are going to want to be using protection for to really keep that risk down, especially with the bacteria. Kay, I am so glad that you wrote and brought up this wonderful topic, and I am Dr. Ruthie, and I will see you in my next Funwares video. Thanks.